Physiologic consequences of hypothermia. So hypothermia is defined as a core body temperature is less than 35 degrees centigrade. It is often further characterized as mild, moderate, and severe. When the temperature is between the 32 degrees centigrade to 35 degrees centigrade, it is called the mild hypothermia. When it is between the 28 to 32 degrees centigrade, it is called the moderate hypothermia. And when the temperature, that means the core body temperature, is less than 28 degrees centigrade, it is called the severe hypothermia. Hypothermia basically affect various organs and the various functions of the body. Thus, it alters various physiological functions. Oxygen and carbon dioxide solubility is increased. This may causes increase in the pH by 0.015 per 1 degree centigrade decrease in the temperature. Cardiac output is decreased. Blood flow decreases in the following order. First, it decreases in the muscle, then kidney, then gut, brain, and heart. Oxygen consumption and carbon dioxide production is decreased. It is decreased by 7 to 9% per degree centigrade decrease in the temperature. PaCO2 is decreased. This is decreased by 1.5% per degree centigrade decrease in the temperature. Plasma catecholamines is increased, that results in the hypertension, tachycardia, hyperglycemia. Plasma insulin is decreased, that also results in hyperglycemia from the activation of glycogenolysis and gluconeogenesis. Hemoglobin affinity for oxygen is increased. This is increased by 6% per 1 degree centigrade decrease in the temperature. This is seen in the oxygen dissociation curve. Here we can see the left side shift of the oxyhemoglobin dissociation curve. Hypoxic ventilatory drive is depressed. Bronchomotor tone decreases. Thus, it increases the anatomical dead space. Hypoxic pulmonary vasoconstriction is decreased. Thus, there is worsening of ventilation perfusion mismatch. Threshold for ventricular fibrillation is decreased, which result in increased risk of ventricular fibrillation, especially when the temperature is less than 32 degrees centigrade. Systemic vascular resistance is increased. Pulmonary vascular resistance is also increased. Both this leads to ventricular failure. Increased systemic vascular resistance leads to left ventricular failure, and increased pulmonary vascular resistance leads to right ventricular failure. Hepatic blood flow decreases. Renal blood flow decreases. Hepatic blood flow decreases in proportionate to the decrease in the cardiac output, but the renal blood flow decreases much more than the decrease in the cardiac output. Diluting and the concentrating capacity, tubular transport of sodium, chloride, water, and the potassium in the kidney is also decreased. All this leads to cold diuresis. This can lead to hypovolemia and hemoconcentration. Blood viscosity increased. It is increased by 2 to 3% per 1 degree centigrade decrease in the temperature. Coagulation is impaired. This is due to the decreased circulating coagulation factors, as also due to sequestration of platelets in the portal circulation. Platelet functions is impaired. This may lead to increased perioperative bleeding. Thus, there is increased chances for blood transfusion. Urinary nitrogen excretion is increased. Drug metabolism is decreased. Effect of most intravenous pharmacological agents that requires end organ metabolism is prolonged. Immune function is also impaired. That is due to the reduced monocyte HLA-DR surface expression, decreased clearance of TNF alpha, increased interleukin 10 release. Hypothermia may also increases volatile anesthetic solubility. This may contribute to prolonged emergence from general anesthesia with potent inhalational anesthetics. It may also decrease the MAC of the inhalational anesthetic drugs. This results in the delayed awakening and postoperative confusion.